I have always been interested in neurology and the neurosciences, which is why I majored in neuroscience at Smith. And also, I've always been interested in public health. And a lot of my other activities at Smith were kind of community based and centered on some of the social determinants of health, but always kind of public health focused. So when I went to medical school, it was a little bit challenging for me to figure out what the intersection of neurology and public health would be. And so I had actually planned to do a master's of public health and medical school at Columbia, where I went for medical school. And I wasn't sure how I was going to use it, so I kind of deferred it. When I went to residency at Hopkins in Baltimore, I did a lot of activities with the stroke team, and they were doing a lot of community activities, educating the public on the importance of blood pressure control for stroke prevention. And so I realized that that was kind of how I could combine my love of neuroscience and my love of public health by focusing on stroke and stroke prevention. So that's the short story of how I came to be interested in doing and focusing on that for my research. I think for me, the thing that helped me to be able to continue to pursue my dream in terms of going to medical school, the biggest part was the mentoring part that I mentioned. I did research with Dr. Harrington in her lab. I was a STRIDE scholar. I don't know if you guys still have that. I was a STRIDE scholar. So for my first couple of years, I did research with her, and then I did other research programs in the summers. And then I did my thesis with her, my honors thesis with her. So having that connection throughout was really important, and having that support throughout was really important. I also had a core group of friends who were actually majors in different fields. So one of them was education, the other one was math. There are two of them who were math. The other one I think was English or history. And we're all very close to this day, actually. We have a group chat that we kind of text each other every couple of days. And so having that core group of friends who also happen to be women of color was really important for me to have that support as well throughout. Now, there were challenges. So after Smith, I went to the National Institutes of Health and worked as like a pre-bac for a couple of years. So a pre-baccalaureate student. They have a program where for people who are transitioning from college to either graduate school or medical school. So I did that for a couple of years. And, I took the MCAT, which you guys hopefully aren't thinking about yet. And I didn't do great on the MCAT. So there were lots of doubts there. And then I was saying I wasn't going to apply to medical school. I was going to wait. And actually I called Dr. Harrington, and she was like, no, you need to apply to all the places. And I'm glad I did, because everything else that I was doing was more important than the MCAT score in terms of me getting into medical school. So knowing when to reach out to the support system, whatever that support system is, and relying on that support system has been really important throughout my career. So there are different, I would say the advantages are to being kind of a woman of color in medicine and in my field, is that I'm able to have a huge impact on the lives of my patients who really kind of trust me when they see someone who looks like them and who can relate to their experiences. And I can also be a voice for them in a space where they normally wouldn't have a voice. So I do a lot with the American Heart Association, focusing on health disparities, especially among African American, Black Americans, and the other where the risk of stroke is much higher. And so I have, because of my experiences kind of throughout, and because of the voice that I have because of my profession, I'm able to do a lot more for my community. So I think that's one of the the advantages, one of the big advantages of being a woman of color in this space. Part of the research that's really important to me is the health disparities part and the systems of care part. So what I study is how to best care for stroke patients and stroke patients from different communities following a stroke in order to prevent another stroke. And so care delivery is what I study, and then health disparities is what I study. And then also the impact of social determinants of health, including kind of racism and structural racism and all these social factors on health and health outcomes in different communities. So I don't feel like I feel that I've made great accomplishments yet, but I do think that I am contributing to the field, and that there is more to come, not just from me, but from my group and from the collaborations that I have. What I would say my biggest accomplishment is mentoring students, especially I have a special, let me see, I am most eager to mentor students who normally wouldn't have exposure to research and kind of how research is conducted. So focusing on students of color and women, giving them opportunities to do research. So I would say that is where my biggest accomplishment is. So I am regularly mentor undergraduates, public health students, medical students, residents, fellows. In my, 7 years as an associate professor of neurology, I'd say it's been about 24 students over that time that I've mentored and given opportunities to present data at conferences and to do not only abstract presentations, but write papers. So just giving them kind of that taste of what research is like. Not all of them are going to go into research, but I think it's important for them to have the experience, to have an experience kind of presenting science, and also to see that is something that they can do if they're interested in it. So I would say that is my biggest accomplishment, and that's really what drives me. So in research, things are slow. You have to apply for grants, and then sometimes you don't get them. And so it can be a little frustrating at times. But the thing that keeps me going is kind of seeing my mentees get interested in research. I mentioned a little bit about racism and its impact on outcomes in stroke patients and cardiovascular disease in general, and how it's been, it's not really, I wouldn't say it's been ignored, but it hasn't gotten as much attention as it should get in terms of how it affects people's health. So and it's not just anti-Black racism, but racism and discrimination in general, and how that affects health. So I'm interested in incorporating more of that into what I already study. So there are, so I look at, if having insurance or not influences whether you're going to have another stroke, or whether your blood pressure is going to be controlled after your stroke. And if your blood pressure is uncontrolled, of course, your risk for stroke is going up. So, but another factor that has been described as being related to whether your blood pressure is going to be controlled or not is your experiences of racism. So if you experience racism, if you experience discrimination, then your blood pressure, just that by itself, is going to be higher. And so trying to understand how to mitigate that, how to decrease that risk, and also understanding the biologic mechanism of that risk. Is it a stress response in your body? So what is the mechanism for the impact of racism and discrimination on health and health outcomes? So that's something that I look forward to exploring more.